Diabetic patients often have less muscle mass and less muscle strength compared to others without diabetes in their same age group. Now, diabetic patients with low muscle mass and low strength have increased risk for health problems. In this video, I review what some of these risks are, like cardiovascular disease, hospitalization, and death, and how exercise in diabetic patients can increase their muscle strength. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. Skeletal muscle loss and muscle weakness has been found to be associated with type 2 diabetic patients. For example, there was a study of 2,600 older adults, and they were followed for about 6 years. And they found that their muscle mass, looking at their thigh, had declined 2 times faster in older women with diabetes than their non-diabetic counterparts. Now, there was another study of older men with type 2 diabetes and an average age of 71, and they found that knee extensor strength was approximately 8% lower, and upper body strength was 13% lower in these older individuals with diabetes compared to those who did not have diabetes in their same age group. As we mentioned before, there are adverse events that can happen medically in these patients who have diabetes and low muscle mass and low muscle strength. And those can include cardiovascular disease and death. So there was a study that looked at 347,000 participants from the UK Biobank. And they found that diabetic patients with low upper body strength had a twofold, that's 100% increased risk of a cardiovascular disease event compared to someone without diabetes and had good strength. But if someone had diabetes and had good strength, they only had an 11% higher risk of a cardiovascular event. And here they saw the same thing with death. Diabetic patients with low upper body strength had a 200% increased risk of dying compared to those who did not have diabetes and had good strength. But those diabetic patients with good strength only had a 36% higher risk compared to 200%. So here again, you could see how important it is for diabetic patients that if they can maintain good strength, although they will still have a higher risk of cardiovascular disease compared to a non-diabetic patient, they will have a significantly lower risk compared to a diabetic patient who was weak. Here's another study that corroborated these findings, but really broke down the different cardiovascular events that can occur with low muscle strength or low muscle mass. In this study, with 1,230 diabetic patients, they compared those with low muscle mass and low strength to those with good muscle mass and good strength. And what they found was increased risks for cardiovascular disease, so about almost 3 times higher risk of cardiovascular disease, 2.4 higher risk of coronary heart disease, 1.8 times greater risk for ischemic stroke, and almost 6 times greater risk of peripheral arterial disease. Sometimes diabetic patients can get so sick that they need to be hospitalized. And here again, muscle strength and muscle mass plays a significant role. In a study of over 1,200 type 2 diabetic patients with an average age in their 60s and were followed for 2 years, they found that greater muscle strength was associated with a 4% reduced risk of hospitalization. And this was both in men and women. Another study showed that for those diabetic patients who were hospitalized, having weak muscle strength was associated with an increased risk of death. And this study had about 600 patients, average age 71. And they found for those people who had muscle weakness or low muscle mass, they were associated with about a 78% higher risk of mortality after being discharged from a hospital. Now, the good news is that doing resistance training can increase muscle strength in diabetic patients. A meta-analysis looked at 360 patients with an average age of 66 years. And the average training period was about 26 weeks, and patients were typically doing 50-minute sessions. And their sessions usually had about 5 to 10 different exercises, and for each exercise, people were doing about 2 to 3 sets, and each set had about 8 to 15 repetitions. And they found that resistance training was able to improve muscle strength by about 38% in these people. And studies have shown that by increasing muscle strength can reduce many of these cardiovascular disease events. So here there's a study of about 12,500 individuals, both men and women, and they found that by increasing muscle strength just by 1 kilogram was associated with decreased risk. So for example, in men, increasing muscle strength by just 1 kilogram could reduce the risk of cardiovascular disease by 12%, heart attack by 3%, stroke by 10%, heart failure by 11%, and death by 13%. And for women, similarly, they found even better benefits. So per 1 kilogram increase in strength was associated with a 30% reduced risk of cardiovascular disease death, 21% reduced risk of heart attack, 16% reduced risk of stroke, 30% reduced risk of heart failure, and 30% reduced risk of death. Let's wrap up this video and go over a few key points. Number one, diabetes is associated with low muscle mass and low strength. Number two, diabetic patients who have low muscle strength and low muscle mass have increased risk for cardiovascular diseases. Number three, low muscle mass and low strength is associated with increased risk of hospitalization and death after hospitalization in diabetic patients. And number four, exercise can increase muscle strength in diabetic patients and decrease their risk for many cardiovascular diseases. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing my next video or in my office.